Welcome, eGP learners. So this is me going solo, talking about all the latest updates in general practice that have been happening over the past couple of days and weeks. And to say I've got some big stuff is a bit of an understatement. We've got some major tech news coming out that's literally dropped today, a few hours ago. In addition, some more stuff around the BMA, the elections, various other things, including structure in general practice, as well as some massive updates in terms of general practice as well, and eGP learning. So let's get cracking, shall we, as we tech enhance your primary care and learning. Welcome, eGP learners. And as you can see, it's just me solo today. No Andy, I'm afraid. Apologies from Andy. He's not been able to attend today. He's had some other stuff he's had to deal with. And I'm sure he'll be back in a couple of weeks as per usual and stuff. But I'm afraid it does mean that you've just got me solo today, giving you the updates of general practice and what's been happening. So this is probably going to be a shorter episode because I don't have Andy to bounce off of. But if you want to join me in the comments, feel free to do so. I know we've already getting some comments from our regular JC Melody saying good evening, and good evening to you, JC, and stuff. And I hope all the other eGP learners out there are doing okay, because we've got some interesting stuff coming up today. What we're going to cover, well, there's some major tech update news that many of you in general practice will be keen to know about, and I'm going to go through what that actually means for general practice from my perspective shortly. We're also going to talk about some of the stuff that's come out from the BMA in terms of what they think is going to happen as part of potential industrial action, and then also some interesting information from the GMC that I think many people in general practice begin to look at, and then just a little bit more about manifesto pledges, that kind of stuff, as well as some interspersed in there some information about eGP learning, because if you didn't know, this week we've actually got like 6 pieces of content coming out. I know I've kind of been a little bit quiet for the past couple of weeks, been really bogged down with work and stuff, but actually kind of got those creative juices going and some really cool things happening in the background. So we will absolutely get to those shortly as well. But we're going to get cracking, shall we? And the first thing we're going to talk about is, like I said, this big thing that's happened in general practice, and that's that digital pathways is broken effectively. So what are we talking about? So for those of you who don't know, digital pathways is the framework that's being used to commission tech moving forward. And this was announced back in October 2023. This is a massive framework. We had similar frameworks coming out at the same time. So the better purchasing framework, which was for digital telephony. But digital pathways was a sizable amount of funding for general practice to utilize and structure around how it will navigate basically the way that practice use tech. This was meant to have been organized back then. It then got delayed till January. It got delayed a little bit further because it was a contestation, or basically someone put a complaint or something like that into it. And then it was thought that it'll be delayed for a little bit longer. And we've now had the update, which I'm going to bring on for you, that basically shows that unfortunately this has been significantly updated to the point where it's not going to go ahead now. So what does that mean for general practice? Well, so this is, like I said, it's a sizable amount of funding, £300 million in total, and I'll explain what it was for in a second. But effectively, what this is saying is that the framework itself has been paused, and the main reason for this has been because of the contestation that was put in terms of the legal claim that it wasn't just. But then also, in addition to that, because of the election, that's also then further delayed it. So it was meant to come out in June. That's been delayed. So therefore, this will have an impact in terms of how local areas procure tech for their populations and for their practices and stuff. And some of you probably noticed the impact of this. So we've seen a couple of providers change their pricing models recently. So Accurix have not confirmed, well, basically the self-book feature is not going to be part of the NHS funding because that was due to finish, and Digital Pathways is meant to take over from that. System Connect by System One, there's some talk about their pricing level in line with other providers because of possibly this change with Digital Pathways and stuff. But effectively, what this means is that ICBs will still be able to access the funding for the digital pathways, which equates to 76p per patient registered. So if we go down to, so this is the actual framework document. I'm just going to go back to show you the funding part of it that says this. So if we look here at the funding, so an average of 76 pence per patient. This was thought to be 93 pence per patient when it originally came out, but that was for the pilot practices that worked with it. So that may or may not still be available. It's a little bit hard to tell at this point. We'll need to hear some more information and stuff. But effectively, this was then to allow basically tech to be procured What type of tech are we looking at? Well, if you go to the annex, it gives you an idea of these kind of tools that it's talking about. So effectively, nationally specified capability support digital pathways, so care navigation tools, online consultation tools, so the original digital first online consultation, video consultation tools that we covered in the comparison webinar back in January, I think it was. Online patient service user requests, so similar aspects of that in terms of allowing patients to make specific requests through digital online routes, and consultation tools. And then other tools potentially could have been procured were ones about communication management, so two-way communication between patients, cross-organization booking, so whether you are separate practices or separate platforms, prescription ordering by citizens, video consultations, and viewing records, and then demand capacity tools in terms of dashboards and stuff, and data management tools. So all of this was under the hood of digital pathways, and what it means that the framework has changed, but the funding is still there. So I guess what my message to many of you out there in general practice would be is contact your local tech teams, your IT teams and stuff within the ICB, because there will be this funding usable on an average of 76 pence per patient for your practice network area to utilize to fund the tech to use these services. Hopefully that should still be available in your area, but I guess the 76 pence per patient is an average that you can look at to figure out what tech you use moving forward. Obviously, your own ICBs may have different ways that they are procuring that tech, and there is some guidance in the documents there, but the framework no longer exists. So it's going to be interesting to see how that percolates down to practices and areas and stuff moving forward. For those of you who are the tech enabled, who are aware of this stuff, if you do want to let me know what your thoughts are on this, do let me know in the comments now. I'm happy to come back to them in a second and bring them on and stuff, because I think this is a sizable change, not unanticipated, unfortunately, given the way things were heading, but it does raise the question of what future funding will look like for primary care tech and how this will work with some of the providers, because many of them have been saying that this will be the thing that decides what they do. So it's now a bit trickier because there's no frameworks to guide them in terms of what to look at this point, and no public ones as such. And all this is obviously mixed in with the new entrants to the market, as well as various other things as well. So it will be an interesting time. Next up, we're looking at some other news stories that come out, and this one is probably no surprise to people as we get towards the election. So the BMA have basically revealed some of their industrial actions that they are planning. This is down to the roadshow events that they are currently doing across the country, speaking to GPs and stuff. And the first event's already kicked off. And as a result of that, we've got some details of what this may look like. So if we have a look at the Pulse website, friend of the channel, we've got some information that's come through. So from that particular event, so I know that they're coming to Nottingham, my local area, next week, for example. Fortunately, I won't be able to attend. I've got another pre-booked event. Always seems to happen. The LMC have events whenever I've already got something planned. Busy man, what can I say? But effectively, some of the actions presented at the roadshow were switching off GP Connect functionality, which permits 111 remote booking. So that's that CCAS stuff that many practices have, where 111 can directly book a patient into and stuff, and provide instead a dedicated telephone connection for when practices have capacity to receive the calls. Switch off GP Connect functionality, which permits the entry of coding into the GP record by third-party providers. I think that's going to have a huge impact, because that will be cross-platform working. That may be a positive as well as a potential negative, because it could change workload significantly and how that works for practices. Withdraw permission for data sharing agreements which exclusively use data for secondary purposes, i.e. not direct care. Yeah, that'd be an interesting one. See patients face-to-face as default unless there is a compelling reason not to do so. I think that's going to be an interesting one for various different practices. I think there will absolutely be some practices who have shifted towards total triage type models who will not want to go back to just doing face-to-face first for everything, because they find it easier to manage the workload and support their patients through those routes, and therefore actually the digital is a positive thing. Versus, I think, practices where actually doing things on a face-to-face route is how they would prefer to do things, and feel that they've been pushed towards doing digital routes by NHS England and therefore don't want to. And absolutely that can work in some ways. And also for patients, it'll be interesting because the capacity access will definitely be an impact. Stop any voluntary services. So that'll be interesting whether that's talking about, for example, enhanced services or whether it's talking about just non-paid services as well. Lawfully exit data sharing agreements which has no direct benefit to patients. So this is similar to the ones above, but more specific to, I guess, non-direct care-based ones. And free sign up to any new data sharing agreements or local system data sharing platform. Now, this is very much in the case of, in the recent contract, it was written there will be closer and more deeper sharing of information, particularly child health surveillance and potentially even border patrols. This could have an impact in some of the other governmental work that was planned as part of the original contract. Obviously, we're now in a PERDA situation where how this will impact contract and stuff moving forward, nobody quite knows. But it's definitely interesting, the stuff that's there. And I think to some people, this will probably feel like, well, it's not much. But actually, data is key when it comes to general practice. One of the key resources we have is the patient record and the use of that patient record and stuff. So actually limiting the access to the information may have a profound effect on various aspects of care that doesn't actually directly damage individual patient care. It's more about population care, which is obviously where it seems NHS England have been asking general practice to move towards. So it does halt some of the actions of the government, I think, to some degree. So those are the plans outlined by the BMA so far. I suspect there may be others coming forward. And as these road shows go round, it will be interesting to see the impact that has on the GP population, but also as this hits the wider news networks, what that will mean as we head towards an election and stuff. I don't know. What do you think? Those of you watching us now, so we've got 60 plus of you currently joining me live on a Thursday evening. What do you think of the suggested actions by the BMA for potential industrial action? Is it bold enough? Should we be doing more? Should we be doing less? I guess it's always challenging to find something that practitioners will agree to do, given the complexity of care that we offer, in a way that's always trying to be supportive of our patients, but also at the point where many practices feel they are at breaking point. I think that's really interesting and stuff. We shall see. Next, we're going to talk about something that's a little bit more specific that's come up, and this is a direct instruction from the GMC, and this is absolutely in relation to some of the things I think many people feel is contributing to some of the challenges that are happening in general practice, particularly in terms of the employment crisis that's currently going through. And this is that GMC says GPs will not be accountable for PAs, effectively. So this is Charles Massey talking about how they will not be held accountable for decisions and actions of physicians associates that they supervise. Now, it does make reference to the fact this is in line with their existing guidance of good medical practice, leadership and management for all doctors, and delegation and referral. So I think it would be worth people having a closer look at those documents in terms of what is suggested. There's not really anything in terms of how to do it in terms of practicalities, but more principles of how supervision in particular should be structured and things. But it does make reference to the thing that many people have been anxious about, which is a previous decision from a tribunal case made in 2017. So the case of Dr. Stephen Zor, secretary care doctor who was suspended for inadequately supervising PA under his authority, which was highlighted by DA UK and various other organisations and stuff as a reason why PAs may not be as effective as people plan, particularly the government and NHS England and stuff. But I think, the GMC have commented that previous decisions shouldn't set a precedent, which is interesting because that's pretty much how the law works, precedent based and stuff. But it does mention that they feel that there should be less concerns and that, PAs are not doctors, they can't replace doctors and stuff, and that they are a multidisciplinary team. There is obviously other plans going on in terms of a legal case against the GMC currently being crowdfunded. I think they've got something like £25,000 worth of funding to make a case. And also there has been other organisations coming up in terms of challenging the use of PAs in general practice. I won't deny that I've been quite public about my views about PAs in primary care. I spoke at the LMC UK conference, which is one of the videos that we put out recently, both in terms of what I said about PAs, but also actually just a couple of days ago, I did a video interview with LMC chair, Dr. Matt Mayer, about LMC UK conference. So if you are interested in having a look at that, do feel free to do so. That's on the channel. And if you haven't already, clicked notifications and stuff and things to be notified of all the content, you absolutely should do, because there's some more stuff coming out imminently. But I think, I very much feel that PAs potentially do have a place in general practice. I think that as ever, it's about how you do it and the people that you employ as a combination of things. It's not a case of that they replace doctors, but they can be a really supportive aspect of medical team to help clinicians and provide some additional capacity in a controlled and supervised way. So I hope that's helpful and useful to people, and absolutely happy to hear any comments and stuff and things that's coming through. Rather interesting comment coming through already. So Anish K. Patel, do you believe him? And I think he's making reference to the GMC guy. So that is Charles Massey. I guess part of the challenge is that the GMC have often said things and done the complete opposite. So should we trust what they say? Well, they are our regulator, but again, does that mean that they do what they should do? Maybe, and not always, and stuff and things. And I think from my perspective, I think time will tell. As I said, it's a little bit interesting that they're saying that case precedents should not be relied on, when actually that's pretty much what they've done before in the past, that precedents do set what happens and stuff. So I think there is a bit of confusion from my perspective in terms of how that looks and works and things. But I think there's also, clear comments that actually this may have more impact and stuff as we move forward and things. Right, what else have we got to cover? Well, we've got a few things. I'm just going to slip in there with a little bit of good news. So for those of you who may have noticed, actually eGPlearning now has 16,000 subscribers. In fact, we just got just over, I think, about 16,036, I believe, at last check. So thank you all of you eGPlearners for sticking with us and stuff. And hopefully, if you haven't done so already, I would absolutely recommend you subscribe and stuff. So to help you do that, so subscribe, make sure you click all the notifications, as well as the notify me for the video. It'd be great if you could like it, share it with your colleagues, and then if you want to see more details, click on more down below. And that's how you can get the most out of eGPlearning from any of our content and stuff. And there is some significant amount of content coming out in the next few days. So obviously we've got the live stream today. Tomorrow actually comes out Epic, our first Epic episode on the YouTube channel. So I have committed to the fact that the Epic episodes that I do, so that's the eGPlearning podcast, Podblast implementation consultation episodes, will come out on the podcast first, and they seem to have been really positively received. So that episode I did with Dr. Ankit Kant talking about KPIs and general practice, that'll be coming out on the YouTube channel. It is going to be for members only, because I have promised the people that have done the episodes that it will be somewhat moderated and controlled. So it will be as part of being a member of the eGPlearning YouTube channel if you want to watch the video version. Alternatively, you can absolutely listen to the podcast version on the podcast. So that's the eGPlearning Podblast, whichever podcast player that you prefer. And then on the weekend, we've also got some more content coming out, which is a digital dictation tool that I've been using for the past few weeks, and my thoughts on it. So absolutely feel free to check that out. And there's lots more stuff like that coming, because I've kind of got back into the recording phase lately and stuff. So we should have some more content coming through for you around particularly the tech and that kind of stuff coming through as well. So what else have we got to cover? Well, the last thing I'm just going to talk about is the BMA's manifesto. So interestingly, in response to a lot of the election stuff that's going on, the BMA have put out their own manifesto as such, and points that they want to make. So I'm going to cover this just briefly. This is the page on Pulse Today, friend of the channel and stuff. And actually, if you go all the way down to the bottom, so the key points they've summarized, because I've struggled to actually find the actual manifesto document. I must admit, I haven't looked very hard for it, because I looked 5 minutes before, because obviously I'm here solo with Andy today. But effectively, the key points they're putting through is cut the red tape to allow practices to hire GPs and reduce locum unemployment. I think that specifically makes reference to the R's budgets and funding and stuff. Deliver new GP contract for England, Wales, which safeguards the sustainable NHS GP partnerships to better deliver services for patients. Governments must work in partnership with GPs across the UK in securing GP contract reform where mutually required. So obviously that's taking impact in terms of the whole UK, where in particular Northern Ireland is struggling with the contracting mechanisms and stuff. But absolutely the involvement of the GPC and various other similar organisations and stuff. Regulate MAPS, so medical associate professionals, by the Healthcare Professionals Council, amend legislation which states regulates them by the GMC, the doctors regulators to separate them, and legislate to protect the titles assistant and not associate. Halt the unsafe substitution of doctors by other professionals in medical care, and pause any further recruitment in MAPS until the medical profession's patient safety concerns are fully addressed. Okay, fair enough. Guarantee jobs for all medical school graduates and improve the job allocation process for newly qualified doctors. Absolutely agree with that. I know that many are concerned that come August, when many of the GP trainees finish their training, we're going to have potentially up to 4,000 extra GPs who may or may not have access to employment in particular areas of the country, and things. Deliver, and that will obviously have an even bigger impact on those people who are currently medical school potentially. Deliver existing promise to expand undergraduate medical education and post-medical training, and critically fund the medical educators and facilities required to realize these promises. So one of the things is the fact that the educators themselves are often not paid to educate the increasing amount of people, and therefore that has a key impact on how people function. And then finally, invest in the NHS infrastructure with a capital funding injection to fix the maintenance backlog, improve community and GP estates, upgrade digital and IT systems, invest in research, innovation and new technology, invest in hospitals. Yeah. I don't disagree with a lot of the BMA manifesto. I guess if we're looking at that summary, the summary very much focuses on the key points of employment side of things. I would have liked to have seen a little bit more detail in the last one, because I think that's also equally important in terms of the longer term challenges that we probably face in general practice. It's not just about the employment, but I absolutely agree there are definitely colleagues out there who are in a more challenging situation. Therefore, for them, focusing on those is an absolute priority for now, and should be as a result of that as well. So let's have a little look, see what comments we've got coming through. So definitely some comments from JC Melody saying that all very interesting, and we shall see what happens. And I guess a congratulations in relation to our 16,000 subscribers for eGPlearning. So thank you all for your support and stuff. You have no idea how much it means to kind of, do all of this and find that you guys still find it useful and interesting and effective and stuff and things. And I hope it continues to do so. Myself and Andy will be back hopefully in a couple of weeks. I am away for a couple of weeks in the middle of July, so I'm taking a little bit of a break at that point. So there will be a bit of a hiatus there, but that will be post pretty much just after the election. So unfortunately, it will be at a time where I'm guessing they will want more news and stuff going on in general practice. But as ever, we will try our best to make sure we keep you fully informed of everything that's going on around in general practice. In the meantime, make sure you do subscribe so you can get all the news straight away in terms of what's going on. And alternatively, if you want to check out one of those videos that I mentioned earlier, feel free to do so. That's coming up right here as we finish off. And as ever, we'll catch you on the channel as we continue to tech enhance your primary care and learning. I'm going to catch you all next time with Andy.